Today I'm going to be performing the catheterization check-off. So I'm going to start with the 12 safety practices. I would verify care and order for the client. I would perform hand hygiene before and after performing care or handling any of the equipment. I would verify the facility's policy and assemble the necessary supplies. I would consult the manufacturer's guidelines for any of the equipment that I'm going to be using. And I would knock on the client's door and identify them using 2 identifiers. And then I would note the overall condition of the client, and I would provide for privacy and explain the procedure. And then I would raise the bed to promote good body mechanics and don PPE if necessary. And then after I'm finished performing care, I'm going to lower the bed and raise the side rails according to the client's care plan and attach the signal light, and then document any findings and abnormalities to the charge nurse. So we're going to start with the indwelling catheter for the female. So I'm going to make sure that she is in the dorsal recumbent position with her feet flat and her legs separated. If necessary, I'm going to get the supplies ready to perform pericare, but we're going to start with our sterile field. I'm going to maintain my 1-inch border. I'm going to go ahead and get my gloves. I'm going to start with my dominant hand. So I'm going to start with the drape. I'm going to make sure I put the shiny side down. And I would have the patient kind of lift their bottom a little bit to help tuck it up under there if they can. And then I also have this drape that if I wanted to, I could lay over the patient like that, but I'm not going to be using that. Okay, so now I'm just going to go ahead and get out my supplies and get them organized. So I've got my sample cup and my label, but we're not taking a sample for this checkoff, so I'm going to go ahead and discard those. So I've got my alcohol swabs that I would open and just set inside my sterile field there. Then I've got my syringe that I'm going to make sure I push out all of the air, and then I'm going to go ahead and connect it. And then I've got my lubricating jelly that I would just open up and I would put inside there and discard. And then I'm going to lay the tubing of the catheter inside the jelly. So now I'm going to go ahead and take my alcohol swabs. I'm going to make sure I keep my fingers at a V and separate the labia. And I'm going to start with the outside from top to bottom, the outer labia. Discard. And then the outer labia again closer to me. And discard. And then with my last one, I'm going to go down the middle and discard. And discard. Okay, so then I'm going to go ahead and I'm going to take my catheter and I'm going to ask the client to bear down as if they were needing to urinate. So then I'm going to insert the catheter 2 to 3 inches until I see urine coming out, and then after that I'm going to insert it another 1 to 2 inches. Then I'm going to hold it in place. I'm going to take my syringe. I'm going to go ahead and insert all 10 mLs. So then I'm just going to have a little light tug on the catheter to make sure that it is in place. And then I'm going to take my catheter bag and I'm going to hang it onto the bottom of the bed or the side rails. Sometimes they have some hooks on the bottom. And then I would perform pericare if necessary, and I would document how the client handled the procedure and anything like that to the charge nurse, and I would clean up all of my equipment. So now we're going to discontinue the catheter. So I'm going to start by measuring the urine that is in the catheter bag. I'm going to measure the amount, the color, consistency, odor, and things like that. And then I would empty it. Then I'm going to go ahead and just set it back in here. So then I'm going to, I would have a clean syringe, and I'm going to reattach it to the catheter. And I'm going to make sure that I remove the same amount as what I put in, so 10 mLs. So then I would have the patient bear down again as if they were needing to urinate. And then I would remove the catheter. And then I would just note the condition of the client, how they handled the procedure, perform pericare again if necessary, and then clean up my equipment and supplies. So that is it for the indwelling catheter. So now I'm going to move this stuff out of the way and get ready for the Foley cath. Okay, so for the Foley cath, I want to make sure that the patient is in supine position with his leg straight and slightly separated. So we're going to start with the sterile field again. Maintaining the 1-inch border and keeping my hands between my hips and my shoulders. I'm going to go ahead and get my gloves on. Start with my dominant hand again. All right, so once again, we'll start with the drape. Shiny side down. Again, I would have them lift up if possible to slide it up underneath. I'm going to go ahead and pull this out as well. And if I wanted to, I could drape it over the penis like that. So for this checkoff, we are going to be collecting a sample. So I've got my sample cup here and my lid. I'm going to make sure I set the top of the lid down. I've got my cleaning swabs. I would have them open, set inside my sterile field. And I have the label that I would place on the sample cup, but most facilities, their cups already come with a label on it, so I'm just going to go ahead and discard of that. So I've got my lubricating jelly that I'm going to take this end of the catheter and set it inside of the jelly, and I would just set it in there like so. So now we're going to ahead and clean the penis. So I would make sure if they are uncircumcised that I would pull back the foreskin. I'm going to grab the penis and hold it up at a 90-degree angle. I'm going to start at the very top of the glans penis and work in a circular motion moving towards the shaft. So just like that. And discard. Circular motion. Moving more towards the shaft of the penis with each swab. Discard. Okay. So I'm going to set this end inside the cup to collect the sample. So then again, I would have the patient bear down as if they were going to urinate. And I'm going to insert the catheter 7 to 9 inches until urine is present. And then once I see that there is, I'm going to insert it another 1 to 2. And then I'm going to hold it with my contaminated hand. And I would collect my sample. And then after I've got enough of the sample that I need, I'm going to set inside my sterile field. I'm going to set my lid on it. And I'm going to leave the catheter inserted until all of the urine from the bladder has drained into the tray. And then once it has, we're ready to take it out. So we will have the patient bear down again as if they're needing to urinate. We will go ahead and remove. And with the urine that is in the tray, I'm going to measure it, for consistency, amount, odor and color and things like that. And then after I have done that, I'm going to discard it and have my sample sent over to the lab with the appropriate time and the right identifiers for the client. And then I would perform pericare if needed and note the client's condition and any abnormalities. I would report to the charge nurse, and then I would clean up my supplies.